Hi guys, welcome back to my channel. It's been a hot minute. I've been busy for the last 18 months. No excuses, let's get into it. So in my last video I said that I would finish up on how I packed and moved to the United States from the United Kingdom. But I've been answering so many questions on how I met the requirements for moving here. It seems to be the #1 topic from people that I've been contacted by. And even though I haven't been making videos, I've been responding, and thank you to the people who have subscribed already. So I'll just get into it. I had to search through for the paperwork, but I found it. So here it is. So I went to Kingston University, which is in Kingston on Thames in the United Kingdom, and I did an international module, and the international module was a book that was given to me. I'm still in the process of looking for it, believe it or not. I still have it 13 years later. Once I find it, I'll show it to you. I don't think they offer an international module anymore because several people have said that they've tried to find it. I know King's College used to do an international module that you could take anytime to meet the overseas requirement, but they didn't get a lot of uptake, and so that program, they got rid of it. The international module I did, it went across the entire lifespan. So even though I did adult nursing, there was something about children, and the children bit encompass maternity, labor, and delivery. I also did a bit on mental health, and it covered the entire spectrum. It was basically a booklet where I had to go and interview a mother and baby and follow them for a period of time. I think mine was 3 days or however long the parent allowed me. So I followed the mother and the baby from the maternity unit, gained consent, and I went and followed the mother up until discharge. So I think, if I remember clear, it was about 3 days. That's what I did for the practical. The theory was for me to go off and look stuff up about from birth, labor and delivery, growing up to toddler. So the book specified, and this was given by my university. It was a booklet put together by them that you did not have to do. But I was told if I wanted to work overseas ever, I should do it. It wasn't a requirement, so a lot of people didn't do it, but I did. I'm sure I've said this in a video before, but it's been a question that I've been asked, so I'm answering it. So sorry if you've seen it already in another video. The other section I did was mental health. So I had a placement in a TB, tuberculosis clinic, and in that clinic I met a lot of people with family members or themselves who had TB, and lots of them had mental illness. So what I did was amalgamated the two. The person I chose to follow in the clinic so happened to have mental illness. Now, that is how I met the requirements for those theoretical hours, but there was also something in the booklet specifying what I should do on mental health. I went and did a research, did a paper. So it just was a series of steps in order for me to say, yes, I met the requirement. I did everything in the book, and once I finished the book, it was written on my transcript that I did an international module. That took care of the theory. However, when I sent off for my transcript from the nursing agency to my university, they amalgamated everything in one and just gave like a complete breakdown of what I had done. I don't know if you can see it, but I'll read what came back on the official transcript. So it break the sections down, and it said that in my practice nursing hours, it said surgical, medical, community, theaters, ICU, learning disability, mental health, maternity, and pediatrics. It told me how many hours I got in each discipline. And it says care of adult medical, that was 350 hours, care of adult surgical, 350. It says maternal, infant, and nursing, excluding gynecology. Please remember that. 175 hours was given to me for maternal, infant, excluding gynecology. You need gynecology in order to qualify for the overseas program. I got those hours because I spent 16 weeks on a theater placement, and during that 16 weeks I went to the gynecology theater, so that gave me the practical hours. It just so happened, I didn't deliberately pick it, but I ended up getting the practical hours because I went to the maternity theater. Also, under the mental health, I told you that I ended up looking after somebody with mental health on one of my placements, and that is how I got those hours. So in my breakdown, when my transcript was sent, they didn't put the theory and they didn't put the practical separate. They just amalgamated everything and said that in my nursing practice, yes, I did cover some. So the agency sent back and said, in good faith, could you just say how many hours across the spectrum? And so they broke it down. So the paper that I received from the agency, I have it here, and it says, I am in the process of applying for a nursing license in the USA, and I need to see if I will meet the US requirements for taking the NClex RN exam. Please complete the grid below detailing my nursing training at your school and return same to me. If the breakdown meets the requirements, I will then be requesting an official transcript for CGFNS and will include an academic request which they will need completed. So this is what was sent to me by the agency after we sent a transcript and my university declined to fill the paperwork in. So when they originally sent this paper, it didn't have that statement on there. They just sent a blank paper with labor and delivery, mental health, adult, child, right across the spectrum, and asked for it to be filled in. So because we don't do our training like that in the United Kingdom, they just didn't fill it. So then when I told the agency that, you know, my university don't really know what to put, it's important to liaise with your university to see where, what you've done and how you can accumulate those hours. I've spoken to people in my comment who have gone through their paperwork and said, oh yes, I did this placement. If you look at your placement carefully, every interaction is important. Because somebody, when I told her that I actually, in my clinical placement, when I went to the TB clinic, how I managed to meet my mental health hours, and she remembered that she went to a clinic and had interaction with children all the time, and that is how she was able to meet the requirements for pediatric. So you have to go through everything carefully, and even if it doesn't say you've done it, as long as you've had some interaction in your 3 years training, you can ask for them to write on there. So just think about your placement carefully before you write yourself off and decide that you're ineligible. There's ways around it. Just contact your university, get in touch with them and say, hey, I train at this time, whether it was long time or recently, I finished and this is what I did. Worst case scenario, request a transcript for yourself and see what's written on the transcript. Because sometimes by looking at the transcript, you can jog your memory and you'll remember stuff that you thought was insignificant, which will become important if you're trying to move to the United States. So once they sent back this statement and said, you know, please see if I meet the requirements, they would accept in good faith. My university went through my transcript and they decided to give me those hours. It's just in good faith. There's no hard and fast rule. They just said, okay then, because you've done this and you went to the clinic and you did this and you did that and you did the booklet, we will give you the hours. Basically, you need about 200 hours for psychiatric and mental health. And community health nursing gave me 200 hours as well, so I ended up having 400 because my community, along with my placement in the TB clinic, In total, my university just rounded up and said probably about 400 hours. Remember, it's a guesstimate. Then for the maternal and infant, you need about 100. I end up getting 175 for the paper I wrote in the international module booklet, which was given to me, and also me following a mother and a baby for about 3 days from birth until discharge from hospital. So that is how I ended up getting those things. So as I said, go through your transcript and see what your university is able to do for you. It may jog your mind. So once they did all that, they just put it, and also for gerontology, geriatric nursing, everything, they just gave a guesstimate, and they accept in good faith that yes, I did complete some. So don't be disheartened and think you don't meet the goals unless they told you outright once they look at your transcript that we don't see anything on here. Please speak to them in the office at your university and see our worst case scenario. I don't know if you have to pay for your transcript. I didn't have to pay for mine. So I requested a transcript, sent it to them, then requested one for myself. I went through the entire thing and I was able to remember stuff I had done. And similarly, I've spoken to people in my comment who have gone on and done the same, remember the placement that they had and managed to meet the requirements with the agency. Your transcript is not a one-page document. Your transcript should have a breakdown of everything that you've done throughout your entire 3 years of training. Some of the courses that you will see, it will have things under there, especially in your common foundation year. So go back to your year 1 and see what you did, and also go through everything that you've done on your placement. Even if you weren't placed in an area that specifically says pediatrics, any interaction that you have that will bring you in contact with children, anything there, their parents, just jog your memory if you've studied a long time ago and see if you can meet the requirements, because it's no hard and fast rule. Once you get here, you're not shoved in those areas. I wouldn't go and take a job in pediatrics because I wasn't trained like they are here in the United States. It's a big part. Labor and delivery, pediatrics, all of that happens on their training. So they're free to be more fluid, and they do take jobs in those areas, but I only look after adult. I always say it, from the age of 18 until death. Before that, no. But for NClex purposes, you've got to know these things, and you have to be as trained as a nurse here in order to meet the international requirement in order for immigration. So that is why the agency are telling some people that you haven't met the requirements, and they're saying no. But try again, please. Don't give up. Just jog your memory, look through, request a transcript for yourself, and see what you can do. A few people have told me that they've tried to see if they could go back to a university and see if they would allow them to do some hours in pediatric or even mental health. It's very difficult because you know the training in the UK, the trainers, the tutors, it's limited. No one's gonna allow you on their unit. But if you could, in conjunction with your old university, you could ask them, please, if you could go ahead and see, especially if you're somebody who is almost finished or just finished, where you're still in the educational system at your university. You could ask them to see if you could follow someone around, if they could give you something to do along those lines in maternity. Pick what you want specifically. May I have 2 weeks here? May I have a week there? But just don't give up. It's pretty easy once you get over that hurdle. So that's what I wanted to address. If anyone have any questions that they want to ask me, or if you want to privately see how they fill in this paperwork and send it off to a Grady, then feel free to contact me. I'll send it to you. Okay, so don't be disheartened. Another one of, I'm gonna wrap this video up. I always talk too much in my videos. In my next video, which I'm hoping to do right after this, since I haven't done any in eons, I'll be talking about NClex preparation, because that's my next biggest question. So stay tuned, and thank you to all my people that's subscribing. Even though I have a few videos, lots of people have gained some knowledge, and that is why I started this channel, to give some knowledge and encourage people to see what's out there and explore with your nursing career. The world's vast and you can learn a lot. So stay tuned. I'm gonna give you some tips about the NClex preparation, and I'll also finish up on my previous video from what occurred after we collected our immigrant visa. So thank you for watching. Like, share, and subscribe, and see you in the next video.